I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. Just last week, the CDC released information that showed in real-world conditions that the COVID-19 vaccines are very effective at preventing infection, disease, and transmission. And the CDC has released additional updates on what vaccinated people can safely do. This information pertains to people who are at least 2 weeks past their second Pfizer or Moderna vaccine, or 2 weeks past their single-dose Johnson & Johnson vaccine. Fully vaccinated travelers traveling in the United States do not need to get a COVID test before their trip unless it's required by their particular destination. And fully vaccinated travelers do not need to self-quarantine following domestic travel. For fully vaccinated people traveling internationally, they do not need to get tested before leaving the United States unless that's required by their destination. All fully vaccinated air travelers, including U.S. citizens, though, are still required to have a negative COVID viral test result or documentation of recovery from COVID-19 before they board a flight to the United States. That test result can be an antigen test or a PCR test, and there are some home specimen collection kits that are tested in laboratories that would also meet that requirement. For documentation of recovery, the requirements are a previous positive test result and a signed letter from your doctor written less than 90 days ago stating that you have been cleared to travel or return to work or school. It's still recommended that international travelers get a COVID viral test 3 to 5 days after travel, regardless of vaccination status, but fully vaccinated travelers do not need to self-quarantine after they return to the U.S. following international travel. Of course, if you develop any symptoms that could suggest COVID at any point after travel, you should isolate yourself and get tested. International travelers also need to pay close attention to the situation at their international destination before traveling due to the spread of variants and because the burden of COVID-19 varies globally. One question I've had from several patients recently has been, "Doc, my grandchild or my bridge partner has a cold or a cough. I'm fine to be around them since I'm vaccinated, right?" It's important to remember that even if you're vaccinated, you should not be around anyone with COVID or symptoms suggestive of COVID. Don't put yourself in harm's way. Also, if you're vaccinated and you feel unwell, for example, you feel like you have a cold or feel like you have a really bad flare of allergies with nasal congestion, coughing, or achiness, please get tested just to be safe. And if you haven't already been vaccinated, please sign up and get your shots, even if you have had COVID, and especially if you're still experiencing any lingering effects from COVID, you should get vaccinated. Vaccination is the best way to prevent the spread of variant strains and to get back to doing the things we love to do. Thank you.